All right, so I'm really excited to introduce you to, our first set of speakers today. So first up, we have Brittany Cesarini. Hold on here, I just lost my spot in my document. There we go. In leading GHC's communication efforts, Brittany Cesarini brings a love of words and an unwavering belief in the power of narrative to help people imagine and build a more equitable world. GHC is the Global Health Corps. Prior to joining them in 2016, Brittany led communications and legislative affairs for Council Member Fernando Cabrera in the Bronx, focusing on key health and immigration issues in the poorest congressional district in the US. Brittany began her career piloting a community-based health program in Dar es Salaam, Tanzania, funded by Henry Richardson Labousse's 26th Prize. She holds a bachelor's degree in public policy, gender and sexuality studies, and African studies from Princeton University. Brittany is fluent in Swahili and an avid reader and writer. She lives in Northeast Pennsylvania with her husband and their young son. So welcome, Brittany. We're so happy to have you today.
Thanks so much, Mike. It's great to be here.
Joining Brittany is going to be Raymond Besiga. I'm so sorry if I'm pronouncing that incorrectly. Please correct me. Raymond is the CEO of Sparkplug, which is a software engineering and technology consulting company that partners with social change agents to create contextually applicable technology solutions that address social and economic challenges. They provide unique insights and solutions to cater to the specific needs of the developing world, while maintaining the highest global standards for technology service delivery. Prior to founding Sparkplug, Raymond worked on disruptive technologies in the Technology for Development Unit at UNICEF Uganda. Raymond served as a Global Health Corps Fellow from 2011 to 2012, and as a MIT Africa iLabs Engineering Research Fellow for 2 years at Makerere University, University of Dar es Salaam, and Massachusetts Institute of Technology. So welcome, Raymond. We're so happy to have you join us.
Thank you, guys.
Raymond will be joined in conversation with Ian Answaba. Ian, I am going to let you intro yourself and take it away with this amazing panel.
Great, thank you for that. Hello, everyone. My name is Ian Answaba. I'm a talent advocate at Power to Fly. For any parties that have just joined, welcome aboard the Power to Fly Tech for Social Impact Diversity Reboot series. It's a pleasure to meet, meet every single individual that's chosen to take part in this conversation with the one and only Global Health Corps, which is a leadership accelerator of health equity changemakers. Since 2001, the Global Health Corps has built a community of health equity leaders by investing in leaders who bring real and sustainable progress in the advancement of health equity. And today, as has been mentioned already, we are joined by Brittany Cesarini, the Director of Communication at Global Health Corps, in conversation with a Global Health Corps alumni and CEO of Sparkplug, Raymond Besiga. Thank you for being here, Brittany and Raymond. Great. So before we dive into deconstructing the Global Health Corps and the stellar impact it's had, I'd wager it'd be prudent to get acquainted with Brittany and Ray a little more. Care to introduce yourselves? Brittany, Ray?
Sure, yeah, happy to. Thanks, Ian. And we've gotten some great intros already, so I'll keep it very brief, just to say, really great to be here with everyone, excited to be involved in this conversation around tech. I am definitely by no means a tech expert, but I do love stories and community, and I'm really, grateful for how technology can fuel both of those things. And also thanks to technology, we're having this very full circle moment for me where I'm here in my hometown of Scranton. I relocated here with my family last year and able to connect with people really around the world, interested in issues like diversity and social impact in tech. So very exciting. And as mentioned, at work, my role is Director of Communications for Global Health Corps. So my team really works to champion the cause of leadership as a powerful lever for change in global health. And we also work to build and amplify the voices and perspectives of young and rising global health leaders like Ray, who are too often missing from decision-making tables in the sector. So I'd like to just turn it over to him to intro himself as well.
Hey guys, my name is Raymond. I'm the CEO of Sparkplug. I think the introduction says pretty much about myself, but I'm really happy to be here. I'm glad to have a seat at the table. I think it's important for just about everyone to have a voice and to be part of the conversation. And yeah, keen to see how we get that going with this dialogue.
Great. Thank you for those intros. And I suppose diving straight into things, Brittany, I suppose I'll begin with you, seeing as, of course, you are indeed presently engaged with the Global Health Corps, I suppose, to an intimate degree. Maybe tell us, what is the Global Health Corps and how exactly is it unique?
Yeah, thanks. So Global Health Corps, we often refer to it as GHC for short. So I'll do that throughout. GHC is really a leadership accelerator, as you mentioned. It was founded initially by Barbara Bush and some of her close friends and peers in 2009. So we've been around for just over a decade now. And really to date, we've built this diverse global network of health equity leaders. Right now, our leaders count about 1,100 strong and growing. And you asked why GHC is unique, which I love that question because I think we really are filling this niche in global health broadly, but then also within, and among leadership development programs. GHC invests in health leaders really early in their careers. So while there are, a range of opportunities for folks who are at senior level leadership roles or folks who are even mid-career, it's not all that common that, young leaders who are really stepping into the sector at the start of their career are getting the kind of intense investment that GHC really provides. And it's not, a concentrated sort of one and done. You join and it's a set period of time. It's really an early investment and it's an often investment. So, we like to say that joining the GHC community is for life. And the way that folks join the community, just briefly, for those who are not super familiar with GHC, the entry point to our community is a 13-month paid fellowship program. So our fellows are gaining experiential experience. They're working on the front lines of global health in Malawi, Rwanda, Uganda, and Zambia currently. And they work with a whole range of organizations, ministries of health, international organizations, small grassroots organizations that are community-based. And at the same time as they're working, they're making an impact in these organizations. They're also participating in GHC's leadership training. So, they're building their skills, they're reflecting, they're taking time to step back from their work and see what's going well, what's not going so well, how is there room to grow. And they're also connecting with each other and building trusting relationships, which, we've seen during COVID that those kinds of relationships are really the currency for making a greater impact. It takes, more than individuals. And so the ability to be in community and a network is really important. And then beyond the fellowship, folks transition to our alumni community and they continue to access, coaching, mentorship, training, seed funding, community building opportunities. Our alumni programming is really expanding and we're working with dozens of partners across the globe, really trying to help our alumni grow as effective, collaborative, influential leaders so that they can propel their careers and their impact on health systems. So while yes, I am, intimately involved with GHC in the day-to-day, I'd say, Ray as an alum and many of our other alumni continue to be really involved in the community, in addition to their sort of full day-to-day commitments at work and personally.
This is a very apparent element, even, of course, on the GHC website. Why do you reckon it's fundamental to focus on leadership for better health outcomes?
Yeah, sure. I can share. And then, Ray, if you'd like to add anything, definitely feel free. From our perspective at GHC, we see that, there have been amazing medical advances, amazing technological advances, but still many people are suffering and dying from preventable illnesses and injuries. And so, we see that there's this gap, that health systems are not as strong as they could be. And we think that leadership is a really important intervention to fill that gap. So, if we look at who leaders are and how they lead and how they show up, that can really be a matter of life and death for the communities that they're serving. But leadership development is really this overlooked lever for change. It doesn't get all that much investment in global health. We think about systems as needing strengthening, but we often don't think about who necessarily is doing that strengthening, right? And that's people. So we are focused on developing systems leaders, as I said, who are intentionally developed at every level of their career, early and often, providing them with the support and the resources they need to design equitable systems to strengthen them throughout their careers. And we think that there's immense potential in this kind of intervention, again, as a complement to other sort of health interventions that are more focused on the medical and technological aspects of health. So Ray, anything to add to that?
Yeah, I think one thing I'd add to that is the more interesting thing about Global Health Core is that leadership is not just about people, it's also about context. Because what happens is that people move into a place or region or organization, and they're working within that cultural context and with the people there. And then you're trying to figure out what kind of people do we need, what kind of skills do we need to really build a foundation for the change we want to see. And I thought that was a really interesting approach and one of the greatest things about Global Health Core.
Yeah, thank you for that. It is definitely an interesting point of leaders as drivers of agendas and initiatives, and kind of grouping health into that space kind of helps drive it along even further. That's rather impressive, GHC. Woohoo! Moving along, still concerns, of course, the GHC program. Brittany, I'm curious, how do you go about selecting candidates for the program? I know you happened to gloss over it really quickly at the beginning, but could you maybe give a more detailed outline?
Yeah, sure, absolutely. So, we are recruiting, selecting, training leaders like Ray and many of his peers. That's sort of a yearly process for us. Every year, we're welcoming people into our fellowship and into our community, and we consistently have high demand. So, a lot of young people are excited about getting involved in global health. They're coming out, applying to our program, trying to get involved in the community. And unfortunately, given current resources, we're able to select only about 2 to 3% of those who apply. So it is quite a competitive program and consistently high demand for it. And the folks we're really looking for in terms of how we select them, as I mentioned, we're targeting those who are early career. So specifically, we define that as people who are eligible for the fellowship is 21 to 30 years old. And Ray mentioned, we're bringing people in from lots of different backgrounds, and that's hugely important, we think, to, advancing health equity. So we're really looking for people who don't necessarily have clinical backgrounds, but rather bring a range of skill sets. So architects, data analysts, supply chain experts, communicators, policy experts, folks who are bringing lots of different perspectives and skill sets to bear on really complex health challenges. And then in addition to sort of their heart, their skills in a functional area, we're also looking for people who show a commitment to what we call our leadership practices. So there are 6 of them. I'll just kind of briefly run through them. They are: be committed to social justice, inspire and mobilize, be self-aware and committed to learning, collaborate, adapt and innovate, and get results. So we're looking for people who, have demonstrated that they are committed to doing these things, to growing in these. We call them practices because you grow, throughout your career. You never sort of arrive and you've got it. It's an ongoing practice. And our process for selection is pretty rigorous. It's a 5-stage process. It engages GHC staff, our current fellows, our alumni, our partner organizations, and everybody is involved in different aspects of assessing who is the best fit, both for the specific roles we're recruiting for, as well as I said, sort of overall fit with the community and our values. I think Ray's been involved in that process most likely, and of course went through it as a fellow himself, so can probably provide a different perspective there.
Oh, yeah, and I think I'll definitely get to that in a bit as well. But before I dive into, of course, Raymond's perspective, Brittany, what do you think the impact of the GHC has been so far?
Yeah, sure. So GHC has trained, as I said, about 1,100 leaders since 2009, and they represent 48 nationalities and counting. The majority of them are women who are, overall, we know that women are vastly underrepresented in global health leadership. So we're proud of that. About half of our community are African nationals. The majority of our people of color. So it's a very diverse community. And as I said, lots of different skill sets represented, different perspectives. And for us, we don't think about impact in sort of the typical manner as, we're scaling. It's not linear, just in terms of hard numbers. Our community does grow each year as we recruit and welcome a new fellow cohort. We just did that actually a couple of weeks ago. We have our newest cohort just joined us at the beginning of July. So we're very excited about that. And our impact grows really as our leaders deepen their capacity to drive systems change. So they participate in our programming, they become, as I said, more effective, collaborative, influential leaders. And we see that as a way to kind of catalyze this ripple effect of change throughout health systems. So, just to give an example of some of the specific metrics that we do assess, things like 76% of our alumni report collaborating with each other for greater impact. 99% attribute their professional accomplishments in part to their GHC engagement. About 82% of them are in mid to senior level roles. So that tells us that they're continuing to grow in their careers. Our alumni are twice as likely to stay in global health or social impact as finalists for the fellowship program. And that's important because, in order to make an impact on health systems, you really need to be in it for the long haul. So we know that in global health, leaders are subjected to quite a lot of challenges. There's really a risk of burnout. So, it's important to us that our alumni are likely to stay in the sector. And we think that that's because, they have this supportive network. They have programming that helps them build resilience. They can count on each other. So they're, again, in it for the long haul, continuing to make an impact over the long term.
Great. Thank you for that, Brittany. So actually now I'd like to hop on over to you, Ray. Actually, I'm held off as well because I'm being an alumni. You're of course privy to a somewhat, I suppose, a different experience with the Global Health Corps. Could you tell us a little about your Global Health Corps experience? For instance, what was your fellowship like, and how have you stayed connected as an alumni?
Great question. So it was Global Health Corps was my very first experience with global health. I came in as an electrical engineer, computer scientist, and luckily for us, there was an orientation period for 2 weeks, just about, at Yale University, and we got to meet all these leaders in global health. It was a baptism of fire in the best way. We learned a lot, and after that, the good thing about it was that we got to meet all these leaders, and I was lucky to create a relationship with one of them, Paul Ellingsad. I think it was the head of global social responsibility at HP at the time, and he became my mentor, and we became really good friends. I visited his family a few times. He visited me in Uganda a few times, but not just as personal friends. We were professional. It's a mentor-mentee-mentor relationship where we kind of mentor each other and are mentored by the other. So it was a good relationship. But in addition to that orientation experience, I think you learn a lot from your peers every quarter, where you meet, reflect, and adjust accordingly, and try and make plans for the next 3 months or so based off of the feedback you get from your peers, your experience, their experience, and your domain of expertise in a way. So it was a really good experience in that sense. Felt quite supported.
Great, thank you for that, Ray. I suppose more so, I'm curious as well. I mean, seeing as you are indeed working with Sparkplug presently, could you maybe tell us a little bit about your company, and maybe are we going to see maybe a GHC Sparkplug come together anytime soon in the future?
I mean, you never know. We cannot really tell the future, but what I can say is that GHC laid the groundwork for the formation of Sparkplug, because after GHC, I worked with UNICEF Uganda in what was then Technology for Development before it became UNICEF Innovate. And we were working on maternal and child health projects. We were working on primary school education, reporting metrics. I was personally working on an education project, and being able to, so one thing is that technology can be used for good, it can be used for bad things, but ultimately it's about the people that choose how they use it. And seeing how we were using technology at UNICEF at the time allowed for me to transition out of that into starting Sparkplug with a premise to do social good, and I think from the get-go, we had really good partners like Clinton Health Access Initiative. We were building a commodity management platform for the national medical stores in Uganda. We're working with the Stucky Hearing Foundation. So it was a really good foundation for understanding what impact looks like. From you can have impact in global health without being a public health professional. I think there's many needs within the context of global health that can be held by technology and other professions. And so that was the foundation for Sparkplug. Right now, we're mostly doing a lot of work in digital financial services and trying to provide tools that help build the financial inclusion agenda. Most recently, we've been doing work with the World Bank CGAP and MTN Group to create an open API for MTN Mobile Money. MTN is one of the biggest telecommunications groups in Africa, and so being able to provide that tool for them meant that a lot more people were brought into the formal financial sector. Yeah, that's how we're doing this.
Well, thank you for that, Ray. And it's funny you should bring up two elements that actually I latched on to as you spoke. The whole, I suppose, technology and impact factor. And I was instantly drawn to the whole element of COVID-19, our present predicament, right? Obviously, during COVID-19, technology has played a huge role in keeping people connected, right? But what has that looked like within the Global Health Core network, which of course spans the globe? Brittany, Ray, feel free to take it away. Honestly, feel free to chime in, both chime in as well if you'd like it.
Well, I mean, I can go first. So, I mean, one way I can think about it is that there's a tool that we built as Sparkplug called Akabo. It's Uganda's only crowdfunding platform, online crowdfunding platform. And around about the time when COVID started, some of the fellows from the alumni network in Uganda created a campaign in Akabo, and they were fundraising for a hand washing sort of a booth in a market, because only market vendors were allowed to sort of operate. But the fear of them catching COVID, the alumni network came together to fundraise for a hand washing station for them, and I thought that was really cool. One of the ways in which technology really helps is, well, one, it is cashless, so you just donate online and from home, and then you're able to remit this money to construction workers and then build this thing. So I thought that was really cool because it allowed for that social connection in a way. You're socially close but physically distanced. I think that's the main takeaway from COVID-19 social dynamics. So yeah.
Brittany, care to chime in as well? Of course, from a real-time perspective, having worked within the GHC as all this played out.
Yeah, sure. I mean, I will say that like many other organizations, our programming was in person before. Ray's cohort and many others after were able to meet in person throughout their fellowship year. And we were able to really pivot our programming to virtual. So for both our fellows and our alumni, we recognize that people were feeling more isolated than ever, would need to continue to be connected. And in particular, we need to be able to lean on each other and sort of support each other in their local COVID-19 responses, because it was something that everyone around the world was trying to respond to. And of course, there are challenges with virtual programming. We know that broadband access is not equal across the globe, but we also saw some really exciting opportunities where our team does a lot of pitching young leaders in our network for global conferences, trying to get them on those stages. And oftentimes we run into challenges around lack of funding for travel or visa restrictions and those kinds of hurdles. In the space where more folks were doing virtual events, a lot of them were removed. And so there were a lot more opportunities for more diverse voices, more underrepresented voices to be present in those global spaces. So I think going forward, even as the world, is still combating COVID, trying to recover from it gradually, there will be some takeaways around, we need to open up access. We need to continue to hear from these folks who are, again, underrepresented in these spaces. And then, on the GHC specific side, we just wrapped up Training Institute. We had done it all virtual. So Ray mentioned being in person with his peers and experts. during his orientation training institute at the start of the fellowship. For this cohort, everything is on Zoom. So we've tried really hard to build that same sense of community. Just this morning, we have our incoming fellows overlapping with our outgoing fellows, and they were meeting together, sharing wisdom. The outgoing fellows are sharing some really hard-won lessons learned and giving advice and just establishing those relationships so that the new fellows coming in feel that they have the support that they need. And then on the alumni program side, we also recognize that in communities, where we had some hubs, some critical masses of alumni, they were able to come together. We provided them with some funding and some programming support to create COVID-19 coalitions. So to do a lot of the work that Ray mentioned around things like, we realize that people in our community need a hand washing station. That's a very real-time need. How can we come together and, design an intervention to meet that need? So we were able to mobilize COVID-19 coalitions in 8 different countries where we have GHC alumni. So have been working on that. And on the whole, our team and community I would say the transition has been somewhat smooth to working virtually because we were accustomed to having a global team, working across time zones, using tools like Zoom and WhatsApp and navigating those differences. So it's been both challenging and I think has opened our eyes to what other opportunities are out there that we can keep embracing.
Thank you for that, Brittany.
I'm so sorry to step in, y'all. I don't mean to cut y'all short, but unfortunately we do have to move on to the next chat. I'm so sorry. Did y'all want to drop any information about where people can follow you or reach out to you?
I'm on LinkedIn. You can find me there, Raymond Besiga. Thank you.
Yeah, I'll just put in the chat the GHC website and our Twitter handles. All right. Thanks so much.
That's perfect. And I'm so sorry to have to cut us short, guys. This was a really interesting talk. I had waited as long as I could because I was really wrapped with attention. So thank you so much for being here. And Ian, great job. It was really nice to get to listen in on this conversation. So thank you to you all.